Good morning, listeners of Hot Topic and Fresh News. Today, May 10th, 2024, breaking news comes from the southern Gaza city of Rafah. The Israeli military operation against Hamas has led to dire circumstances for local medical facilities, particularly the Abu Yusuf al-Najjar hospital, which was abandoned after an evacuation order. This hospital, critical for its dialysis department, is no longer operational as fighting intensifies nearby. Furthermore, access to critical surgeries at the European Gaza hospital in Khan Yunis has been cut off, escalating the health crisis. The Kuwaiti specialist hospital in Rafah is now overwhelmed, facing a surge of emergency cases with insufficient capacity, staff, and equipment. The hospital's director, Dr. Jamal Al-Hams, has described the situation as catastrophic, with essential medical devices like the X-ray machine out of commission due to damage from Israeli shelling. Other crucial equipment failures, such as the complete blood count analysis device, are complicating treatment for patients with severe trauma, burns, and other critical injuries. Additionally, field hospitals in Rafah are under-equipped and unable to provide necessary services like dialysis, intensive care, or even basic blood banking. The closure of the Rafah crossing with Egypt has further compounded the crisis, stranding patients needing medical treatment abroad. The World Health Organization has issued a warning that without urgent fuel deliveries, hospitals in Rafah and other parts of southern Gaza may soon be unable to continue operations. Stay tuned as we continue to monitor this developing story. Hello everyone, this is Emily coming to you live from Hot Topic and Fresh News.
And I'm David, at your service.
We're thrilled to have you with us. Don't forget to subscribe and turn on notifications to stay updated with the latest news. Straight to the hot topics.
With the situation in Rafah escalating, can you elaborate on how the medical infrastructure is coping with the current demands?
Absolutely. The medical infrastructure in Rafah is under tremendous strain. With the largest hospital, Abu Yusuf al-Najjar, being evacuated and other facilities like the Kuwaiti specialist hospital lacking necessary resources, the city is struggling to provide adequate health care. They're dealing with an overflow of emergency cases, ranging from complex trauma wounds to severe burns and even cases involving exposed brain tissue from skull fractures.
I heard there was also a chemical component used in the attacks that exacerbated these injuries. Can you confirm that?
Actually, that's a prime example of misinformation that we need to clarify. There's no verified evidence to suggest chemical weapons were used. It's crucial to rely on confirmed reports from trusted sources. Spreading unverified information can create unnecessary panic and confusion.
That's an important correction. I apologize for that slip. Going forward, I'll ensure to double-check the facts before mentioning such critical details.
That's wise, thank you. It's essential, especially in conflict zones, to base our discussions on accurate, verified information to maintain the integrity of our reporting and provide our listeners with reliable news.
Can you tell us more about the challenges at the Kuwaiti Specialist Hospital?
The challenges there are dire. The hospital was already small with limited capacity, only 4 intensive care beds before the conflict escalated. Now, they're overwhelmed with patients and facing a shortage of both staff and equipment. The X-ray machine and complete blood count analysis device are both out of service, making it even harder to treat and diagnose patients effectively.
With the evacuation of the Abu Yusuf al-Najjar hospital and the closure of medical points by Project Hope, how severe is the healthcare crisis in Rafah now?
The situation is critical. The loss of the Abu Yusuf al-Najjar hospital has left a gaping hole in healthcare services. Field hospitals and smaller facilities like the Kuwaiti hospital simply don't have the infrastructure to handle the volume or the severity of the cases they're now seeing. This includes a lack of dialysis services, oxygen stations, and even basic blood banks.
Given the urgency, what are the implications of having such limited medical services available in the midst of this crisis?
The implications are dire. Without adequate medical facilities, the rate of preventable deaths will surge. The lack of basic services like dialysis or intensive care means that even non-conflict related illnesses become life-threatening. The region is on the brink of a major humanitarian disaster if medical aid isn't restored and facilities aren't reopened or sufficiently supported soon.
What has been the response from international aid groups to this crisis?
It's been complicated. While groups like Project Hope are doing what they can, the closure of their clinics and the evacuation of their staff highlight the severe restrictions they're facing. The international community needs to step up efforts significantly to provide the necessary medical supplies and support to reopen these vital healthcare services.
With the ongoing violence and the closure of the Rafah border crossing, what are the broader implications for the people in Gaza?
The closure of the border crossing not only affects medical supplies but also the flow of food and other humanitarian aid. Continuation of this situation could lead to an even more catastrophic humanitarian crisis, affecting thousands of civilians who are already struggling from the conflict. The international community must act swiftly to prevent further deterioration of living conditions in Gaza.
With the closure of the Rafah crossing, what's the situation for those needing critical medical treatment abroad?
It's a dire situation. With the crossing closed, critical cases like Haytham, who is suffering from a severe lung injury, and Zaina, a young girl in a coma due to liver complications, are stranded. They are unable to access the specialized medical care they desperately need, which could potentially save or significantly improve their quality of life.
Médecins Sans Frontières has suspended activities and discharged patients in Rafah. How significant is this move in the current healthcare climate there?
It's catastrophic. Their withdrawal represents a huge step back in healthcare provision under already strained circumstances. The teams from Médecins Sans Frontières were key players in providing essential post-operative care, and their departure leaves a void that the already overwhelmed local facilities are ill-equipped to fill.
We've heard reports of malnutrition and increasing instances of diseases like hepatitis A and cholera. What can be done to mitigate this public health crisis?
Immediate international intervention is needed. The local field hospitals are doing their best, but without adequate supplies and manpower, they're fighting a losing battle. Increasing international aid and reopening healthcare facilities must be a priority to prevent a full-blown public health disaster.
The Israeli military claims it has reopened the Kerem Shalom crossing for humanitarian aid, yet the UN reports that fighting makes it impossible to access supplies. How do you interpret these conflicting reports?
This represents a critical disconnect in efforts to provide aid. Reopening the crossing is a step in the right direction, but it's futile if the ongoing conflict prevents aid from being distributed. There needs to be a coordinated effort to ensure that aid not only reaches Gaza but is also accessible to those who need it most. The international community must demand and facilitate a cease in hostilities to allow humanitarian efforts to proceed unimpeded.
There's a looming threat that all hospitals in Rafah might shut down soon due to fuel shortages. How critical is the fuel supply to maintaining healthcare services there?
The fuel shortage is a ticking time bomb under the already precarious healthcare situation. Hospitals rely on fuel for everything from operating essential medical equipment to powering ambulances. Without a swift resolution to this fuel crisis, the entire healthcare system in southern Gaza could collapse, further endangering lives.
What steps can be taken immediately to avert this healthcare collapse?
The priority must be securing and facilitating the swift delivery of fuel to these hospitals. It's imperative that all parties involved cooperate to ensure that healthcare services can continue uninterrupted. International agencies and neighboring countries need to play a key role in logistics and ensuring that these deliveries are made safely and swiftly.
As we watch this situation unfold, what should our listeners be particularly aware of in the coming days?
Watch for updates on the fuel delivery and any international response to calls for aid. The situation is dynamic, and the healthcare needs are immediate and critical. Public awareness and international pressure are crucial in addressing these humanitarian needs swiftly and effectively. Thanks for tuning into Hot Topic and Fresh News today. We delved deep into the escalating crisis in southern Gaza, discussing the dire healthcare situation and the urgent need for international intervention. Your presence and engagement with our channel help keep these critical issues in the public eye. Please remember to subscribe, hit that bell for notifications, and share our content far and wide. Every like, comment, and share helps us grow and continue providing you with the most urgent and pertinent news updates.
And hey, while you're sharing, tell your friends how Hot Topic and fresh news keeps you informed and sometimes just a tad entertained. We're here daily, bringing you the freshest analysis and the stories that matter. Make sure not to miss out on what we've got lined up. It's going to be something to watch.
We're incredibly grateful for your support and enthusiasm. Looking forward to having you with us next time.
Until then, keep questioning, keep discussing, and, as always,
stay in the loop, keep your eyes on the news, our channel's content will amuse.